2020 has been a historically challenging but illuminating year in our country's history. As the SARS-CoV-2 virus and global pandemic, commonly referred to as COVID-19, spread, it laid bare and vividly exposed centuries-old disparities and frustrations among citizens of the United States. Often, as we legislators take on the role of advocating for people, that's in the job description, it's what we expect. But for me, the role of COVID-19 workgroup chair took an unforeseeable and unexpected twist as I received a positive diagnosis. What began as a few disturbing feelings of fever and headache, it evolved into a concern as to whether or not I should make a call that I would normally make for anyone pushing for testing that wasn't as available as our nation's leaders said that the testing was. I had to make the decision to make that call for myself because, like most people, my symptoms did not necessarily adhere to the very strict and specific CDC guidelines of symptoms that would determine whether or not I could be tested. I pulled that lever and made the phone call to ensure that I could get tested, which led to my family members getting tested, feelings of guilt, feelings of fear. Would I die? Did I give this to my family, my aging parents, and other family members? And after my Lieutenant Dan moment, when I cried out to God and wondered what I should do as a legislator, as a daughter, as a sister, I just knew that I had to get tested. And if my life was spared, that I had to give a testimony, that I had to tell African Americans, you can get it because I'm African American. I had to, as a legislator, ensure that my community was getting the testing that it needed. And I did that. I also knew that whatever I could do as a member of NBCSL and in whatever leadership capacity and whatever fellowship capacity that I could, that I would do that. And for me, my commitment to whatever I could do as a member of NBCSL was born. We stood up the NBCSL COVID-19 working group as a way to begin to mentally unpack, digest, and analyze the numerous ways African American people would be affected by this pandemic, and how to respond as their voice, as our voice, to a federal government that was unable or unwilling to help them, to help us. Typically, in a disaster such as this, the federal government leads mitigation, response, and recovery phases of a response plan. This spring, when the cavalry did not come as expected, we began to increase and further develop as our independent knowledge and information about the disease did. While some waited for new studies to confirm what we knew and expected, NBCSL took action by first conducting our first public health webinar. We confirmed anecdotal information that persons with high incidence of respiratory ailments, heart failure, hypertension, immunosuppressive diseases, and cardiac disease are disparately impacted by COVID-19. Simultaneous to gathering and confirming data, we began to leverage our relationships with state legislators and appeal to the National Governors Association because their members had control of state resources and they could quickly protect communities of color. We immediately began to put our heads together and draft what would be the key points that we would relay to then President Governor Hogan. Our President, Gilda Cobb Hunter, led us in a meeting with then Chairman Governor Hogan, where we referenced our prepositioning argument, which essentially provided for an argument for our governors and for the nation to preposition resources in the same way that a general would preposition resources to fight where there was greatest harm to come to populations, or where a county judge in my neck of the woods, that's like a county mayor, would pre-position resources to shore up the levees at the weakest points to ensure that there wasn't a breach. What we did was made the argument that we know who is being most greatly affected, how they're being most greatly affected, and why they're being most greatly affected. Why would we not provide the kind of resources and the kind of leadership that we see in our generals and our county mayors? You will hear from immediate past chair of the National Governors Association, Governor Hogan of Maryland, who will speak to you about how we evolved a relationship out of the needs of our constituents and really came together around what we could do together between NBCSL and the NGA. He will also talk about effective policy measures to really move the country in the right direction to attack COVID-19.
I'm Maryland Governor Larry Hogan, and it's an honor to join you virtually for the National Black Conference of State Legislators annual conference. As the chair of the National Governors Association, I had the opportunity to meet with NBCSL's president, South Carolina State Representative Gilda Cobb Hunter, back in April to discuss strategies to mitigate the impact of COVID-19 among communities of color. This included the procurement of PPE and increasing our testing capacity. Throughout the pandemic, we have made communities of color a key focus of our response. We were one of the first states in the nation to release racial data for COVID cases and deaths. And while the nation was undergoing a testing shortage, we moved quickly to stand up our first drive-through testing sites in the hardest hit areas, including Baltimore City and Prince George's County. We opened thousands of hospital beds across the state, including the reopened Laurel Hospital and turning the Baltimore Convention Center into a special field hospital. As part of a $500 million in economic relief efforts, we created a low-interest loan program dedicated for minority businesses, as well as a program to incentivize Maryland businesses to manufacture PPE across our state, especially in our population centers. And we're partnering with community leaders every day on a unified public health communications campaign to help slow the spread of the virus. This virus is far from over, and state and local leaders will continue to lead on the front lines of this battle. We remain strongly committed to our partnership with the NBCSL, and I am confident that by reaching across the aisle, we will get through these challenging times together. Thank you, and I wish you the very best for a successful conference.
We are pleased to welcome Dr. Anthony Stephen Fauci, who has become a household name. He serves as the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci will provide us with a COVID-19 update and thoughts on where we will go from here as legislators, as NBCSL, and as a nation.
Greetings. My name is Tony Fauci, and it is my great pleasure to speak to the National Black Caucus of State Legislators about COVID-19. Thank you for the opportunity to contribute to your annual legislative conference. As you can see from this first introductory slide, I'm going to give you an update on what is going on currently with COVID-19 and talk a little bit about the road ahead. As we all know now, this disease was first recognized at the end of December of 2019 in the Wuhan district of central China. Within a period of a few weeks and in early January of 2020, the Chinese identified a new strain of coronavirus as the source of pneumonia outbreak. This is similar to the viruses that we saw years ago with the original SARS in Guangdong province of China, as well as MERS, the Middle East Respiratory Syndrome that arose in 2012 in Saudi Arabia. Let's look at what this virus has done to our planet, how it has challenged us in such a profound way. This is the most devastating outbreak of the pandemic nature of a respiratory disease in 102 years, dating back to the 1918 pandemic that devastated our planet. There have been now almost 60 million cases and 1.4 million deaths globally. Unfortunately for us, the United States has been the most severely hit country in the world, which, as of literally a couple of days ago, there have been 12 million cases and over 250,000 deaths thus far, with the outbreak still raging. The darkness of the colors of this heat map, as we call it, show the cases per 100,000 throughout various states in the United States. We have never got down to a low baseline from the time we were first hit back in the early spring of this year. And if you could look at the cases that are shown in the light gray bars and the slope of the increases when we've had surges, 3 separate surges in the early spring, then in the late spring, early summer, and then now currently in the late fall, you can see we are in a very precarious situation as we're surging throughout the country. That's the epidemiology. The transmission, as we know, is a respiratory-borne virus that spreads through respiratory droplets, some that drop within a few feet, hence the rule of avoiding close contact, others that tend to stay in the air because of their smaller size over periods of time and spaces, and definite reason why mask wearing is so important, and I'll get to that in a moment. Virus is found in a number of body fluids, stool, semen, and ocular secretions, but their role in transmission is unknown and likely not significant. What we're seeing now is, particularly as people gather indoors as the weather gets colder, is that family gatherings of dinners with friends and family appear to see an increase in now cases of infections emanating from those seemingly innocent gatherings where an individual might be infected, have no symptoms, and infect the 8 or 10 people who are there at the social gathering in the house. This is in addition to the types of spread you see which tend to dominate, such as in bars and gyms and other large gathering places. The fundamental public health principles to prevent the acquisition and transmission of infection are shown here, 5 of them. Universal wearing of masks or cloth face coverings, maintaining physical distance, avoiding crowds in congregate settings, doing things outdoors to the extent possible, much preferentially more than indoors, and frequent washing of hands. A very important part of this outbreak is that up to 40 to 45% of the infections are without symptoms. So individuals at the community level are inadvertently spreading infections to others until someone gets symptoms and then may have a serious outcome. The clinical manifestations of this disease early on are very similar to a flu-like syndrome, with fever, cough, fatigue, loss of appetite, shortness of breath, muscle aches. However, some of them get the loss of smell and taste, which precede the onset of respiratory symptoms, which is unique for these types of infections and is a big red flag signal that you're dealing with COVID-19. Of those who do get symptoms, about 80% of them are mild to moderate, not requiring any distinctive medical intervention like hospitalization. About 15 to 20% are actually severe or critical, usually requiring hospitalization and, in some respects, intensive care, leading to actually death. Hence, the case fatality rate goes from a few percent in those severe individuals to as high as 20 to 25% in those who require mechanical ventilation. The manifestations of severe disease are dominated by the acute respiratory distress syndrome, difficulty breathing, often requiring mechanical ventilation, but also other organ systems like the heart, the kidneys, the neurological systems can be involved. There's what's called a hypercoagulable state, where there is blood clots in the small vessels, as well as in the large vessels, sometimes leading to stroke, and a multi-system inflammatory syndrome seen in children. In addition, those who get ill, even those who get mild illness, as well as those who become hospitalized, when they clear the virus from the body so that they're no longer infectious, often have, and we think it's somewhere between 25% or more, the lingering of symptoms, even though they no longer have the virus. This can last anywhere from weeks to several months and even longer. And what it is a characteristic constellation of symptoms and signs, including extreme fatigue, shortness of breath, such as people who are formerly good athletes having difficulty climbing a flight of stairs, muscle aches, sleep disturbances, and what some call brain fog, or an inability to concentrate or focus. The people who are at increased risk for severe illness, the ones that I mentioned, the 15 to 20%, are older adults and people at any age who have underlying medical conditions like hypertension, obesity, diabetes, chronic lung disease, and heart disease. In addition, there's a profound racial and ethnic disparity where African Americans and Latinx, as well as Native Americans, Alaska Natives, and Pacific Islanders have an increased incidence because of the nature of most of the jobs they have, putting them in contact in the front line with people, have a higher incidence of infection. And when they do get infected, they have a higher rate of hospitalization. As shown on this slide, if you look at the upper three bars, Latinx, Hispanics, Native Americans, and Blacks, 400 plus per 100,000 population, the rate of hospitalization, compared to 115 in whites. There are a number of therapies that have been shown to be effective, usually late in the course of disease, but a number of others of them are being tested. We have ones for therapeutics for early disease, like monoclonal antibodies, convalescent plasma. There are therapies for moderate disease, as well as adjunct therapies. We don't have time to go into all of them, but a lot of work is being put into developing therapeutics, probably the most effective of which are those for advanced disease, such as dexamethasone. And finally, in vaccines, there are a number of vaccines that are in clinical trial that the Operation Warp Speed of the United States federal government is subsidizing with a considerable amount of resources, as well as coordinating the testing of these vaccines. They're shown here using different types of vaccines. That's what we mean by a platform. And the three that are there are the different platforms we're using. These are the companies that are developing them. And a number of them, of the 6 that we're supporting, 5 of them are in advanced clinical trial, and actually 2 of them have completed trial. You've heard of the very favorable results of the Pfizer product, which is more than 90%, 95% effective. Similar to that, the Moderna product, again, 94.5% effective. Both of these will likely be available following submission to the FDA in the middle to end of December. And as we get into January, February, March, and April, more and more people will be able to be vaccinated who are in the various gradations of the priority group. By the time we get to the end of April, the beginning of the May, we'll be able to have it for the general population, namely people who don't have high risk or positions that put them at higher risk. I want to point out one thing that's very important. There is a reluctance in this country to get vaccinated. About 50% of the people feel that they would want to get vaccinated, and others, particularly among minority groups such as Blacks and brown people, Hispanics, Latinx. If you look at the bottom of this slide, 40% of African Americans said they didn't want to have the virus. 32% said they were not sure. Sort of the same type of display with Hispanics. What we've got to make sure we absolutely do is to reach out to the community and explain that the process of this testing and the determination of the safety and efficacy was done independently by independent bodies making that decision, who have beholding not to the federal government, not to the company, but to the general public. When those data were made known that they were safe and effective, advisory committees that are, again, independent and then career scientists at the FDA will make the decision. So I want to assure the listeners to this discussion that the process is transparent and it's independent. And when the FDA comes out with a determination that a vaccine is ready to be distributed because it's safe and effective, I have complete faith that that is something that I would do, that I would take the vaccine, and that I would recommend to my family that they do also. Having said that, finally, even with a vaccine with a high degree of efficacy, we must not abandon the typical low-tech public health interventions like mask wearing, physical separation, avoiding crowds. Because until we get the overwhelming majority of the population vaccinated and we have a broad umbrella of herd immunity, there will still be a risk that you might, in fact, be infected and or transmit it to someone else. I'll stop there and thank you for listening.
One of the first lessons we as NBCSL members learned was just how interconnected our society is and just how all-encompassing the impact of a global pandemic can appear and really how global it is. At the first connection between a virus that perhaps originated in a Chinese wet market and the lack of toilet paper and Lysol available for American consumers was not apparent. It wasn't until later that we began to truly learn the physical and mental costs and impacts associated with COVID-19. So what did we learn? Number one, we are not done. Number two, we work better in teams. And number three, we need an advisory committee. I would like to express my gratitude to the NBCSL COVID-19 Working Group and the opportunity to work on this important issue for and with NBCSL. On behalf of NBCSL, I would also like to thank Dr. Anthony Fauci for his leadership and his participation at our 44th annual legislative conference. I would like to express my gratitude to the NBCSL COVID-19 Working Group and the opportunity to work on this important issue for and with NBCSL. On behalf of NBCSL, I would also like to thank Dr. Anthony Fauci and past NGA Chair, Governor Larry Hogan, for their leadership and participation at our 44th annual legislative conference.